Love that. That's awesome. I have patients that come and see me all the time, and Kaiser is notorious for this. But a lot of the insurance companies, you'll go into your portal, and instead of like one page of lab data, you'll literally click, let's say, blood glucose, or you'll click just
Yeah.
one lab value, and you get one page. And so you'll have literally 30 pages of lab data that could just be on one page. And I've heard that you guys have kind of expanded and have a transcription service where people can plug in that data and consolidate it. Can you talk more about that?
Yeah, well, this actually started when I was working with you, Doc, and I was your patient, and we were trying to monitor all these labs, and
Hmm.
you were in Austin, and I was in
Yeah.
San Francisco, and I had some of my lab data in the UCSF portal, which is University of California at San Francisco, because they were
Yeah.
right next to my house. So I'd go there to get some blood. I had some data in the Quest portal. I had some of my labs in the LabCorp portal. I had some of my labs in the St. Mary's portal. I had some of my labs in the Stanford portal, and then the rest of them were sitting in PDF files and paper. And this
Oh
is the
man.
state of healthcare right now. Even inside of the Kaiser portal, like you said, it's so bad that like you cannot even get a simple trend line of arguably the most important data for your
Unbelievable.
time above ground. So one of the things we do in our software is we make it really easy to get data from all these fragmented places and put it on one trend line. And when I did that for myself, I could actually see back 10, 15 years into my medical history. Even though the doctor I've been working with only has 1 or 2 years of information on me, I had another 12 years of data. So we can now reach a point where actually the individual patient is far more educated and empowered on the trends of their body, even than the doctor, because we're giving you ways to have the full story, the longitudinal data. It just doesn't exist. It's kind of mind-boggling, actually, that the industry is still so behind in just basic data presentation.
Unbelievable. Well, so that's amazing that you have this ability now to consolidate it. So someone goes in, they create an account. Is it just they take all their PDFs that they may have saved on their Google Drive or Dropbox and just kind of drag it in and it uploads? How does that all kind of start? How does that process start?
Yeah, let me give you an example. You'd sign in. Okay, you'll have a dashboard. Your
Oh, by the
dashboard will
way,
have
just real
like,
quick, I can share my screen with you if you want to just show it. Do you have the ability to show it live?
I do. Can I share my screen?
Yeah, let me get you set up. Yeah, yeah, you can do that. Just go and I think, do you see the little up arrow button next to the camera? Should be in the middle.
Yeah, I do.
Yeah, hit share screen.
Okay, it's got to allow me to give permissions to Google Chrome. Hold on a second. Later.
Perfect.
Let's see if this works. It wanted me to restart Chrome, Doc, but let me see if I can just give it a go. Can you see it?
There it goes. Yep, there it goes. Perfect.
All right, so let's take a look. So the first thing
Great.
you'll notice is you want to start tracking on your dashboard. You can see I've got my Dexcom sensor connected here. These are all of
Nice.
my glucose measurements coming in. I'm also tracking certain supplements and medications. So you can see this is the dose I'm taking of my weight loss peptide. You have ways to track symptoms, whether you've completed your workout, your body composition data. So this is like the stuff you measure at home. Then you have the labs. That's what you were asking about. Let me show you how that works. The first thing you can do is connect your portal. So you gave the example of Kaiser. Okay. So all you'd have to do is come in here and connect your Kaiser portal, not unlike you'd connect your bank account to like QuickBooks, for example, or Mint.com. You connect
Yep.
your portal here, and then what we do is we pull all of that data in and we put it on one beautiful trend line. So you can see here's my cholesterol
Love it.
going from.
Absolutely love it.
So this is, you can see this was my results stock from last month. I was 150, and I can go all the way back to 2000. Sorry, this was the oldest. That's 2005. So in 2005, I was at 150. That's how far back I can go. And then September, when was this? 9/3/2021. I'm at 196 on my most recent reading. So me as the individual, I've now got 16 years of history. These are all coming from different patient portals and labs and everything like that. So
Nice.
you connect your patient portal, and then if you have PDF files, all you have to do is upload those PDF files, and we'll transcribe them so they show up on your chart. So now
Got
we're
it. So
giving
just
you
that little
full
file tab, just
agency.
that file tab, and then you can just literally throw them in there.
File, upload, and then we have a team that will key them into your account. Why does that matter? Because now you're not looking back through 3 different doctor portals and 14 PDF files to see the trend in your triglyceride levels. Like, it should just be right there at your fingertips. That's the
And
most
by the way, I was
important
looking at your
data.
labs; those HDLs were going up real nice. I like that.